Autoimmune diseases are diseases which are characterized by the presence of autoantibodies. That is why these autoantibodies are tested when we are doing the diagnosis of autoimmune disease. What you mean by autoantibodies are these are basically proteins, immune proteins, or the antibodies which are directed against the own cell tissues or cells in the body. So instead of the immunological system working against the foreign or infection, it is basically working against our own cell tissues or cells in the body. So that is what is an autoimmune response. And this is seen in autoimmune disorders. And that is why we use tests known as autoantibody tests, which are autoantibody detection, which is useful for the diagnosis of autoimmune disorders. These tests, these autoantibodies is not a single antibody, but they could be organ-specific or they could also be a multi-system disorders, autoimmune disorders. So there are various autoantibodies which are available. About more than 100 antibodies are available. For instance, in a condition like rheumatoid arthritis, you have antibodies like anti-CCP, which are useful in the diagnosis. In a case like a SLE or a lupus, it is not a single antibody, but various antibodies. So we start off with doing a test like an ANA, what's called as anti-nuclear antibody. And then there are some specific antibodies like the dsDNA antibody, SM antibody, nucleosome antibodies. In the case of Sjogren's syndrome, again, you have antibodies like SSA and SSB antibodies. So there are various antibodies, and it's just an example that I have given. And when I come to terms of organ-specific antibodies, like for instance in diabetics, you have something called as GAD antibodies or islet cell antibodies, which are present in a condition like thyroid. You have something called as TSH receptor antibodies. So that is why it could be organ-specific or multisystem. And all these are basically because of an autoimmune reaction which happens, and that is why we test for this autoantibody assays. And you need specialized procedures which have to be done for detection of this test, the autoantibodies for the diagnosis of these conditions. And these help not just in diagnosis, but also helping to some extent in monitoring the diseases. And these are sometimes pathogenic mechanisms by which these autoantibody diseases evolve. So not necessarily, but this could be because of they do play a pathogenic role in some of the autoimmune conditions.